My name is Doreen Kane, and I am a registered nurse. And I have worked with Dr. Sandu and several orthopedics for 15 years at least now. His pain management to me is fantastic, bar none. He has his own way of doing it. His patients that I see normally when they come out of the operating room have a PCA, which is a patient-controlled analgesic. And usually they don't have to hit it as much because he does have pain management from the very beginning, all medications by mouth. So usually we can take them off of their PCA, which is probably day 1, maybe day 2 post-op. They get up, they get moving really quick. I find that they have very, very great results. I also have worked with him in rehab for, I think, maybe 12 years. And when we got them to rehab, they would actually come from one of the medical floors into the rehab unit where there was no patient-controlled analgesic. And I'd have to say that all of his pain medications, his patients would very rarely ask for anything for pain. They were all very satisfied with the pain management that they had. So even with physical therapy, working with them, you very rarely would have to give them anything PRN if they needed it. So pain medication-wise, I think he's doing a fantastic job. I see him myself. I've seen him for my shoulder, and it's fantastic. My shoulder, actually, I have arthritis in it. So I saw Dr. Sandu back in 2009, and I think at that time it was frozen. I kind of didn't really want to go see anybody. And then, as I got to know him and got to see all of his patients who have no pain, it was him that I chose. His patients have no pain, they have no infection, so I went, saw him, he injected my shoulder a few times, then did arthroscopic surgery on it. And I still, if I have any pain issues at all, which I will have for the rest of my life, I go in and I see him, and he does my pain management, gives me an injection, and I go off on my way. A happy person. Yes, I would recommend him. I have recommended him to several people. And most of his patients that I talk to, in nursing, will all rave about him. They like him. They like the way that he comes in and sees them. He sees them quite frequently when they're in the hospital. If you call him, I have his cell phone number, so we call him, he answers. Anything that his patients need, they get, and I would definitely recommend him.